Hello everyone, I hope you all are doing great. So today I am here with another high yield topic for student preparing for USMLE exam or NEET PG exam. So the topic guys is pyruvate kinase deficiency. So I'll be talking about what exactly is pyruvate kinase deficiency and the pathophysiology, then the signs and symptoms, how do you diagnose this condition, and the most important, how do you differentiate pyruvate kinase deficiency from glucose 6-phosphate dehydrogenase deficiency. So guys, try to watch the entire video, and after watching this video I'm sure you can answer any question related to this topic. And if my videos are helping you guys, then please like, share and subscribe. Okay, so let's jump into this topic guys. So the pyruvate kinase, so any enzyme deficiency by definition is a recessive condition. Okay, so that is why it's an autosomal recessive disorder, and the mutation is in the PK, that is pyruvate kinase PKLR gene. Okay, and how does the hemolytic anemia occurs in pyruvate kinase, we will see in the pathophysiology. So it's the most common cause of RBC enzyme related hemolytic anemia. So the pathophysiology, here I have not explained the detailed steps of glycolysis, some of the important steps related to pyruvate kinase deficiency. So the steps in glycolysis, as you all know, that glucose gets converted to glucose 6-phosphate, and I have skipped the further steps here. Then 1,3-bisphosphoglycerate, then 3-phosphoglycerate, 2-phosphoglycerate, and then phosphoenol pyruvate will get converted to pyruvate. And what is the enzyme? That is the pyruvate kinase. So when pyruvate kinase is forming pyruvate through phosphoenol pyruvate, it will generate ATP. Okay, and as most of you must be knowing guys, that RBC do not have mitochondria. And what is the function of mitochondria? Mitochondria is the powerhouse of the cell, and since RBC don't have mitochondria, it cannot generate ATP. As a result, it depends on glycolysis for ATP. That is why RBC depends on pyruvate kinase, so because it will give the ATP to the RBC. Okay, so what happens if, let's say this is a person guys, okay, this is a person and who do not have pyruvate kinase in pyruvate kinase enzyme. So what will happen? He will not generate ATP, right? This ATP is not generated, and the RBC in his body, what happens? This is, let's say this is the RBC, and the RBC has a sodium potassium pump, and that pump will depend on the ATP. So when pyruvate kinase is not there, ATP is not generated, and the sodium, water always follows sodium. So sodium and water will be there inside the RBC. The RBC will swell up, and that will lead to hemolysis of the RBC. Okay, so the RBC will become rigid and there will be dehydration. Okay, and then the RBC is taken up by the spleen. As a result, there will be splenomegaly, which I will talk in the next slide. Now, very important, okay, what is the relation of 2,3-BPG and oxygen hemoglobin dissociation curve? So there's decreased hemoglobin affinity for oxygen as there's an increase in 2,3-BPG. Now in pyruvate kinase deficiency, why there is an increase in the 2,3-BPG? So guys, when this pyruvate kinase is not there, all this will go up. The phosphoenol pyruvate will go up, 2-phosphoglycerate will go up, 3-phosphoglycerate will go up, 1,3-bisphosphoglycerate will go up, and that will lead to increase in the 2,3-bisphosphoglycerate. So when 2,3-bisphosphoglycerate increases, now I want to explain a very high yield graph. Okay, this is oxygen hemoglobin dissociation curve. So you can see this is the y-axis and this is the x-axis here. So on the y-axis you have the saturation of oxygen. Okay, and as you can see, this is the blue graph is the normal blood. Okay, and this the red one is the increase in the 2,3-BPG. So in pyruvate kinase deficiency, there is increase in the 2,3-BPG, that is decreasing the oxygen affinity for hemoglobin. So more oxygen is loaded to the tissues, okay, and that will lead to rightward shift of the oxygen hemoglobin dissociation curve. So increased 2,3-BPG leads to rightward right shift of the oxygen hemoglobin dissociation. Okay, so that's an important thing you should know. And in the next slide I'm going to talk about the signs and symptoms. Okay, now as we saw that when the RBCs are getting damaged or hemolysis, they are taken up by the spleen. As a result, there is splenomegaly. The RBC also releases indirect bilirubin. As a result, that leads to jaundice. And because there is more bilirubin, that are prone for gallstones. And this is RBC why there is a hemolysis, because as we saw that the ATP is not there, the sodium and the water is getting accumulated inside the RBC, and that is leading to hemolysis of the RBC. Okay, the next important is diagnosis. How do you diagnose pyruvate kinase deficiency? Now, I have just explained a normal RBC which you can compare with the echinocytes or the birth cells which you see in pyruvate kinase deficiency. Now, as you can see, this is the normal RBC. A normal RBC has a normal 1/3 pale. It's 1/3 is pale and this all of it is hemoglobinized. Okay. But in case of pyruvate kinase deficiency, the peripheral blood smear will show echinocytes, which is also called bird cells. Now, how will they describe echinocytes? It's a small and uniform projections. You see, uniform and small projections on the surface of the RBC, and these are the bird cells. Okay, and how do you do a test for pyruvate kinase? You do a pyruvate kinase activity test, and because the enzyme is deficient, there will be decrease in the enzyme activity. And you can also do some genetic testing for pyruvate kinase deficiency. Now here I have written some important points. Let's say guys, you are doing some multiple choice questions, and by looking at these questions you can immediately know that you are dealing with the hemolytic anemia. Now, what are the causes of hemolytic anemia? Why hemolysis occurs? One of the important thing, as we saw here, is pyruvate kinase deficiency. Other causes can be a malaria parasite or a babesia inside the RBC that can damage the RBC. Paroxysmal nocturnal hemoglobinuria can damage the RBC. G6PD deficiency can cause damage to the RBC. So reticulocytes, normally it is 0.5 to 1.5%, but in hemolytic anemia it may even go 2 or more than 2%. Why? Because when RBC gets damaged, the bone marrow will try to produce more and more premature RBC. As a result, there is a reticulocytosis. The RBC also releases an enzyme called lactate dehydrogenase. That is why in all hemolytic anemia, the level of lactate dehydrogenase will go up. Now, why the haptoglobin is coming down? Globin is coming from liver, okay? And as we saw that inside the RBC we have heme plus globin, okay? G is globin. So the free heme will come out of the RBC, and the haptoglobin will bind to the free heme, and because it gets utilized and binds to this free heme, then its level will go down. Okay, that's important. Its level goes down. Unlike the lactate dehydrogenase, the reticulocyte and the indirect bilirubin will go up. Now, why the indirect bilirubin is going up? As we saw that the RBC also releases bilirubin and its level will go up. So whenever you see these levels, guys, it is always, you should remember that you are dealing with a hemolytic anemia. Okay, as the questions are time sensitive, so you can smartly answer the question. Okay, Now, lastly, guys, I want to talk about how do you differentiate pyruvate kinase deficiency from glucose 6-phosphate dehydrogenase deficiency. In pyruvate kinase, in the peripheral blood, you can see burst cells, or is also called echinocytes. But in G6PD deficiency, we see the bite cells, and there is no Heinz bodies here, but you see Heinz bodies in G6PD deficiency. Now, what are Heinz bodies? The pathophysiology of G6PD is the free radical H2O2. It can, when it attacks the RBC, it causes denaturation of the hemoglobin, and that is called Heinz bodies. Okay, so guys, I hope this video has helped you, and if you got some knowledge from this video, then please like and share, and also share and subscribe. Okay, and if you have any doubt, you can let me know in the comment section. And anyone interested to take tutor classes for step 1 or step 2 CK, then you are most welcome. You can reach out with the phone number I have already mentioned in the description box. Okay, thank you so much.